Hi, good morning, everyone. Thank you for joining us today. We have a very special topic that we are going to be speaking about called navigating through the healthcare system, the U.S. healthcare system with IIH. And today we have Miss Nicole Rodriguez. She is an user experience designer and she has IIH. I will let her explain what it is exactly that she does, because it's very interesting in how she ties that into being diagnosed with IIH and navigating through the healthcare system. That's why we are featuring her today as a speaker. We will kindly ask everyone to just please keep their mics on mute. If you have a question, just field it through the chat. I promise you we will get to your questions when appropriate, and we will save some time at the end of this hour to have any discussions, questions, more advice, more questions, and we will get to all of you. So just through the chat, just send me the questions and I promise we'll get to it. So with that being said, I'm going to turn it over to Miss Nicole. And well, while Nicole's getting set up, I just wanted to introduce myself. I don't know if I've ever really introduced myself to the IIH community, but my name's Edith. I'm the moderator for today. I'm a physician assistant. I have been working in the medical field for over 20 years, mainly in surgical subspecialties. And I have been a patient advocate myself. I have personally done peer-to-peer reviews. I've personally helped patients navigate through the healthcare system, and including myself navigating through the healthcare system. So I hope to also kind of chime in here and there from a provider standpoint, any questions that anyone may have as well. So now I'll give it back over to you, Nicole.
Okay, thanks, Edith. So yes, thanks for having me. I really appreciate the opportunity to be here. I just want to do a quick introduction. I have a lot of topics to discuss, but this IIH Hub has been a really important resource for me. So I'm really honored to be here to share the things I've learned in the last year. So I want to talk about, just do a quick introduction, go over my early symptoms and diagnosis, how I've managed my care, the resources, my support system, how I've had to speak up to find and also find collaborators within the healthcare system, all of the health insurance challenges that are faced here in the US. And then I have an update since sharing my story on IIH Hub. I think that was around March timeframe. A lot of things have happened in between. So I was just going to share an update on that. So just a quick introduction. As Edith was saying, I am a user experience designer. But first, I've been an IIH patient for the last year. I was diagnosed in April 2023. So I just had my 1-year anniversary, which means that my headache is 1 year old. It's always there. It's always just kind of dormant. I am taking Diamox to keep it manageable. And that's working okay. Like I said, I found IIH Hub last year around this time when I had there were no really updated resources. It was sort of like dusting off an encyclopedia to do a search for any helpful information about this condition. And really, I just wanted some updated terminology so I could articulate my needs to my providers. Before I was an IIH patient, I was and still am an endometriosis patient. So that means that I've learned a lot of skills around advocacy and documentation, and really just learned how to just sense when I wasn't being heard and when it was time to move on to a new provider. So I used a lot of those skills to navigate IIH. I am a user experience designer, so I specialize in service design, which means that I work to improve the interactions between the service provider and its users. So it's much like hospitals and patients, but I don't work with that group right now. My job is kind of learn about the problems that people are facing, trying to accomplish their tasks, and understand how they're impacted and offer recommendations for how to improve those. So when I'm not working, my brain is always in that mode. So as a patient in a broken healthcare system, you can imagine I'm always finding opportunities to redesign processes that I know I have no say in, but I think would make a great case study. So I'm not, always noticing my own personal struggles. It's also the person who's checking in for an appointment who didn't get the call about the cancellation, or the doctor who wants to enter different instructions for prescription. So having said all of that, it's a really big problem to tackle, but I realized I do have a say in some of my patient experience. So I'll share a little bit later what I did to address the challenge of summarizing several months of events and symptoms in a 15-minute appointment. So my full patient story is here on the hub. So I won't get into all of the details, but I'll just kind of summarize what was happening before I had the really painful disruptive symptoms. It really started with pulsatile tinnitus, which was in my left ear for about a year. And it just, it seemed like I had a lot of stressful things going on. It didn't seem weird because just everything was kind of weird at that time. So it just mixed in with other things that were going on with stress and getting through it. I was just plugging along. The gradual loss of visual acuity, just noticing that when I had my yearly eye checkup, that I needed like a much stronger prescription for my glasses. My optometrist referred me to an ophthalmologist. Everything was fine. So, there's nothing to worry about. As time went on, I did eventually get that sharp, unrelenting pain behind my eyes, back of my head, a new kind of pain that I just couldn't articulate. It was not a migraine, but that was the closest thing that I could, guess that it was. Going to the doctor, we tried different therapies, medications, and eventually he sent me to the ER. And so that's where I was admitted, and we went through the whole gamut of the CT, CTV, MRI, MRA, MRV, the whole alphabet of imaging, and then the lumbar puncture. And all of that we ended up with the diagnosis of borderline-ish IIH, which is what the neurologist in the hospital told me was kind of, you're close, your lumbar puncture opening pressure was 23, the criteria is 25, plus papilledema. I didn't have papilledema. So he just said, losing weight is going to be the way to go for you. So don't know that you really have it, but just lose weight and let's find out like if the symptoms go away. So that was kind of the first approach. Managing the care and support. So after getting this borderline-ish diagnosis, I was kind of left with all of the findings in the imaging. So you get the report and it says you have a constellation of findings, including empty cella, optic nerve tortuosity, prominence of cerebrospinal fluid in the optic nerve, but not papilledema, stenosis of the lateral segments of bilateral transverse sinuses, consistent with underlying idiopathic intracranial hypertension. All of those words seemed really important to me, especially the stenosis. That was concerning to have limited fluid output. I was very concerned about all these things. The neurologist that I saw was still really convinced rather that weight loss would be the thing to help me. He believed it was also migraine. He wanted to treat me with Nurtec. I did not take it. Those medications work by constricting blood vessels. I wasn't going to do that when I had stenosis. So I didn't take it. So, I did have to do a little bit of really digging to understand like what's happening with my body? How do these drugs impact my body? And then, make choices for myself. Luckily, I had my primary care physician who explained that all the different specialists that I needed to see: endocrinologist for the empty sella, the neuro-ophthalmologist to check out my eyes, the neurologist who would kind of be in charge of the whole thing, managing medications and that sort of thing. So with that came all the admin, all the tasks of orchestrating these appointments, finding out who is even in my network for my insurance. Who can I see? Who do I want to drive to? The other thing was I couldn't see screens very well at this time because of the flare-up that landed me in the hospital and got this whole thing started. I was having very blurry vision, and it was very frustrating because it wasn't bad enough to warrant urgent appointment with a neuro-ophthalmologist, because the exam in the hospital showed no papilledema, but I also couldn't do my job. So I did have to take leave from work. I did have to rely on a lot of help around the house. And I did have to learn all of the unexpected heavy lift of crafting communications to all the people and all the, the different things in my life. So HR, my colleagues, my manager, my family, different levels of communication for different audiences, different amounts of detail. So that was a very unexpected thing that I had to do, and really hard to do when you're not feeling well and you also can't see your screen. The other, it's a very, you're threading a needle there too. You don't want to appear that you can't do your job because you need your job. I happen to like my job a lot. I was just about to receive a promotion, and I worked really hard to get where I am. So it was very difficult to just say, you know what, I do need to take a time out and take that leave from work. So the other thing is naming your needs when you don't know what they are. This was a thing that I've never really had to do. I've never had such a serious ongoing illness that I needed kind of a sustained plan. I needed ongoing support. So really just figuring out that having dinner made for me is like actionable. It's easy to ask for, and people are happy to do it. And also learning to have a lot of grace for other people around me, family and friends who are really, they want to help, and they're not always going to say the right thing. And it's very hard for them to see their loved one like in this situation. So there was in this phase, there's just a whole lot of growth happening that was very unexpected. And really it ended up, the best thing for me was finding others who are in this situation too. So I'm not on Facebook, but I found the subreddit for IIH was infinitely helpful. It really is a kind and supportive community that is really about, it's like a sanity check. We all just kind of do a sanity check for one another most of the time. And there are a lot of people who are scared, and they're in a lot of distress. They're burnt out, completely lost, and they're just coming into this process. And so just seeing the overwhelm that people are facing in the very beginning is really eye-opening. And you don't realize, oh, that was probably me, but you're just getting through it and trying to stay above water. So it's just really important to find that kind of support. This is just a quick snapshot of the last 12 months now that I've had my 1-year anniversary. It's amounted to 5 months of missed work, 75 appointments, and that's just what's in my chart. There are other appointments for providers that are not in my chart. About half of those were face-to-face appointments. The other half were labs, imaging, tests, and procedures. And then my prescription app tells me 51 pickups for different medications. Not 51 different medications, but that's just a lot of time to be opening that package and throwing away the leaflet that's included. These are, this is my team, basically. I did see 4 different neurologists. It took 3 tries. The first 3 were not as helpful. I didn't expect that to be such a problem. There are plenty of neurologists out there in network for me, but I went through 3 of them very quickly, and then one of them who ended up being the most helpful in the end. Sadly, she's leaving her practice, so I have to find another one. So there's about to be 5 neurologists on my list. But I also saw an endocrinologist, neurosurgeon, neurointerventional surgeon, 2 ophthalmologists, and 1 neuro-ophthalmologist. So this part, the speaking up and finding collaborators. So this is part of the 4 neurologists. When I see a new provider, and this is something I learned going through my endometriosis diagnosis, was that it's really like it's the start of a collaboration, but it also doubles as an interview. So how they listen to you, how you're treated, how that first appointment goes is, to me, the indicator, which I know people have rough days and it's not always fair to kind of judge, like it's just a snapshot of that day, that moment in their day. But there is a difference between making connection with a provider and one who is really not hearing what you have to say or taking your concern seriously. So a lot of doctors wanted to do the lose weight and see approach, which was not acceptable for me. I was in so much pain, didn't have medication in the beginning. Really, it was 3 months before I had any Diamox, which gave me finally some relief when I got it. But it was really, really crucial to get back to work, back to my life, also get somebody who cared about the stenosis as much as I did. Many people didn't. So in that first appointment, if it was not, if I didn't have indications that this person was going to be a collaborator, I did not return to their office. And for other appointments, when I had my first appointment, I knew that I had 15 minutes to spend with them. And so probably 5 of that is me telling my story. And I wanted to, so also in the user experience designer mode, I wanted to make this an experience for the doctor where I'm giving them just what they need, not too much. They just need to make, they just need to be able to make decisions about what's already been done, what needs to happen, what are my concerns, and cut out all of the extra. So I needed a way to kind of make appointments more efficient. And I couldn't always assume that they had read my chart or that anything in my chart was worded in a way that was complete or conveyed my top concerns. So it was really up to me to convey all of my top concerns. So after several rushed appointments, I developed this template for myself, and I filled out most of it after the fact, and I'll show it in a moment. But it's also something I started filling out ahead of my appointments just to kind of prep so we could have more efficient conversations and just get right to the point. And so I would bring it with me on my laptop. And so coming into appointments with the laptop, doctors are like, oh, okay, you've come prepared. And And it's nice to just have something to look at, you know, the two of you. So once I did start getting collaborators and getting like a response to that type of appointment conversation, things started going a lot better. But I do want to note, you know, I'm also coming from a place of privilege. I have insurance that lets me kind of hop from specialist to specialist. I have, these are all within driving distance. I have transportation to get there. And I have the flexibility to take leave from work to do like all of this admin. And I'm a cisgendered white woman. So all these things together gave me the ability to do all these things, you know, pretty easily, even though it was a lot. I do have that privilege. So I just wanted to call that out. So the other part about building your team, I have my home team, of course. These are the people closest to me. My family, my friends, the people who checked on me and sent supportive cards, care packages, and messages. They brought me meals, drove me to appointments, helped with yard work. And I really, if you're an IIH patient, you know the feeling of when you bend down to pick something up. It's a really, really bad feeling. So lots of yard work help. My mom in particular retired early just to help me out so she could be available to drive me everywhere. So, oh, whoops. One last thing about the collaborators that you do find. So when you find your keepers, you have the folks that'll further your treatment. So if you're at a dead end, your collaborators, they're not going to let you get to a dead end. If you're at a dead end, you may need to start looking for new collaborators. I had to do this a couple of times. Things started moving again when I found the people who cared about the stenosis, the interventional radiology team, who finally said, oh yeah, we should check that out. We are going to do a diagnostic angiogram with venogram. And lo and behold, I had a pressure gradient that made me a candidate for a stent. So it took about 6 months to get that set of collaborators. But they're out there. They're just a little harder to get to sometimes. Specific healthcare challenges in the US. So I have Cigna. I have it through my employer. And the way it works in the United States is that you have open enrollment, and that's the only time you can make changes to your insurance. You can have a life event that creates an exception where you can drop that insurance, go purchase new insurance through Healthcare Marketplace, but you have to meet that criteria. And it's usually, you know, the birth of a child, a death of a loved one, a marriage, a divorce. There's a whole list. None of that applies to me. So I have Cigna until the end of the year. One of the things that Cigna does when you have a procedure, so in my case, when they found that I was a candidate for the stent, the neurointerventional surgeon said, great, we can stent you. Let's, you know, set up your surgery. I had already been through this process with a neurosurgeon who was going to do a combination procedure of a diagnostic, and then if he saw the pressure gradient, then he would treat me. That procedure was denied by Cigna. So this neurointerventional surgeon wanted to try this approach. We did the diagnostic, we had the data. We felt that would be enough for Cigna, scheduled the surgery, and they request more information. So this is just standard. They want to know, tell us more about why you're doing this big, expensive procedure. So luckily, my collaborators, my partners, my care team had everything ready to go to Cigna. They sent them all the information. Cigna maintained that it was medically unnecessary. They sent the denial. They said, you can't have the surgery. We're not paying for it. We did a peer-to-peer review. Again, my collaborator was convinced if I can talk to a peer and explain this procedure, we're going to have a good chance. He said, I can explain it really well, where they can see that it's very critical. Had the peer-to-peer review, and they maintained the denial. So this led to appeals, asking for another peer-to-peer review. There's just a lot that they kind of put you through that may or may not be a successful way to change their mind. So when it comes to choosing or avoiding a carrier, if you're in a position, so if you're in the US and you're starting a new job, or you are just entering your IIH journey and you happen to have Cigna, this is kind of a heads up. You know, I can't speak to your specific contract with your employer or the arrangement that you have, but I would highly recommend avoiding Cigna, because we've spent really since January up until now trying to get them to cover this surgery. And I've included the procedure code that we attempted for anyone who's interested there. And the recommendation also is, if you're shopping for new insurance, research their coverage guidelines for that procedure code. First, find out that procedure code from your provider, or, ask, do some research to find out the different possibilities for that code. And you may have to work with an insurance agent, but that would be my recommendation, to find out specifically what their guidelines state. So as an update on my story, there's been a few things that have happened in the month and a half or so since I shared. Now, as I mentioned, since January, my provider has been requesting a second peer-to-peer review. That's really the thing that we're after. We learned that once you appeal, you are kind of cut off from having any more peer-to-peer reviews. So you can't plead your case anymore after that. So that's what we wanted to avoid. My wonderful team. So I want to shout out to Dr. Chaudhry and my nurse practitioner, Garanka Vucenovic-Kanus. She, I don't know how many hours she spent speaking with Cigna support, faxing reams of documentation, and then Dr. Chaudhry for being available for peer-to-peer reviews. Like, he was just ready to talk about it at any moment once Cigna was ready to listen. Unfortunately, Cigna has not responded to our requests. We have been through several rounds of submitting paperwork, having it get lost. When you call, there's no record of it. They ask us to do something else. So we're stopping all of that, and we are taking the next step of moving ahead with the surgery. We are scheduling it. I'm having it next month, less than a month from now. And it's really, to keep my brain safe, essentially. I had a very bad flare-up in the last month where I missed quite a bit of work. It was a little bit scary. It was as if my Diamox had just stopped working out of nowhere. And really, we don't want that to keep happening. So we're going to go ahead and get the treatment that I need and kind of go from there. So the one thing that I wanted to share, I wanted to save it if we had enough time, was show you the template that I used for my symptoms and appointments. So let's see, is this, yeah, this is still sharing. So this is a template that we're going to make this available on the website. It'll be cleared of all of my details, of course. It'll be ready for you to use for your own. But as a patient, this is what I used to track either how an appointment went. So after the fact, I filled this out. Definitely March, April timeframe last year, I was not filling this out. I didn't have the wherewithal to even come up with this. So this was filled out after the fact, but it involves creating a timeline, the date at the top, the symptoms, and the planning for care. So all of those details, the doctor that you saw. So this is helpful if you're like planning appointments and you need to keep straight like all of the different providers and specialists, the location, pre-populate it with questions that you have, the medications that you've taken. So basically all the things they're going to ask you when you get in the room, but also when you're attending the appointment, any notes can go in here, any next steps. And this part at the bottom is checking in with yourself. This is something that I really didn't do until people were asking me, like, what do you need? How can I help you? Sometimes just thinking about how that appointment went, or like when you get new information, you're like, oh, now, like, what am I supposed to do with that? It's just nice to capture it, and it lets you check in with yourself, how you're feeling about it. And if now, there's something new that you need, or you have questions that you thought about after the fact. So this is something that scrolls. So I didn't include my entire record here, but just imagine an infinitely scrolling timeline that had, 75, well, maybe not 75, 37 or so of these appointments with notes. So that's what I wanted to share. I think that is it. If we had any questions or anything else that you wanted me to go back and talk about.
Well, thank you very much for sharing your story. You have really summarized a whole year and a half plus of your time into like 30 minutes, which is incredibly difficult to do because it doesn't even give it justice. But thank you for doing that for us, especially what was most like for me was 51 hours. I mean, that's insane. I mean, it's really more, but like, tangibly, you were able to find 51 hours of your time, missed work. I mean, the list goes on and on, the finances, the strain, the struggle. Thank you very much for sharing that. We hope, if we added it on the chat, but we hope that you guys find Nicole's template useful. I love the advice of bringing your laptop to the doctor's office. I think it gives the provider a sense of, okay, they're ready. They're ready to show me what's going on, and they're going to make it very easy for me because, yes, providers sometimes do have that 15-minute constraint. And unfortunately, that is not enough time. But I'm so happy to hear that you do have some providers that do take their lunch breaks to call, get on the phone, wait the hours for someone to pick up on the other side. It really helps tremendously get you approved, and we can't wait to hear how you feel after that stent is placed. I did add to the chat for anyone to review some of the procedure codes that Nicole's team has used and that we on our side, Dr. Goban and other neurointerventionalists and neurosurgeons use as procedure codes. Because another piece of advice was when you're searching for an insurance that's right for you, sometimes finding out if those procedures are even covered is huge. You're saving countless hours, countless months, years even, for all of this. because this didn't happen to you, you'd have the stent in by now as of January. So we really appreciate you even, thinking to mention that to anyone. But if anyone who's here in the audience would like to, tell us their story or any tips or advice, we would love to hear from you. Feel free to unmute yourself and introduce yourself first so we know. I have one person on the chat that mentioned that they were diagnosed with IIH, and they are on 1,000 milligrams of Diamox. Their opening pressure is elevated at 33, and their neuro-ophthalmologist believes that weight loss will help her. And they're recommending about a 40-pound weight loss, and her endocrinologist prescribed Wegovy. So we would be very interested to hear anybody's experience with those sorts of medications. In fact, our next webinar in June will be about GLP-1s. That falls in that class of medications. We are going to talk about that with a nutritionist who has a lot of experience with patients on that. So please keep us posted. Somebody on the chat asked if they could fly from India to the United States on Diamox. We just wanted to reply to them to let them know, as long as your symptoms are controlled and you feel okay. Sometimes flying with change of altitude, you might get some more headaches. So just stay hydrated, make sure you have enough medication and that you're stable on a certain dosage. Patricia mentioned that Canada, getting your medications from Canada helps lower the cost of prescriptions, sometimes much cheaper than the United States. We're lucky to have that. And Clarissa, thank you very much. Please get back to us and let us know your experience. That would be great with the GLP-1s and Wegovy. And on our website, we have added the templates that Nicole has kindly shared with us, the symptom tracker, the appointment tracker. So you can download it or keep it on your computer for your provider.
Edith, Angela has a question. I think she wants to come off mute.
Yes, please do.
Hi, I just wanted to say that in 2022, I had the venous the stenogram or whatever it's called, and I had a stent placed on my left side, and I was awake during the procedure, and then my pressure went from 19 to 6 as soon as they placed it. So there's hope. It did hurt when they placed it. So when you go for the procedure, say just be patient and stay calm. But it did. So my Diamox, I was on 2,000 a day and Topamax 75 twice a day. So I've stepped down to 500 Diamox once a day, and I'm on 50 Topamax still twice a day. And I haven't had that many headaches since, but I just wanted to say, like, sometimes I still get a headache every once in a while if I definitely bending over. When you said that is, I mean, it made me feel like it gave me a sense of calm. Like it is real. Like I still get some pressure headaches, but just feeling that getting off the Diamox, that medication, stepping down from that has helped. So I just wanted to say good luck for the stent procedure, and be patient with yourself, because it works. So that's all I wanted to say.
Thank you. No, thank you for sharing that, Angela. That's really kind of my next bit of research, is just finding out how everybody's post-stent experience has been. So it's really helpful to hear how it went for you. So I'm looking forward to it, even though I know there's a little bit of pain up front.
It's only for a few seconds, then it gets better.
Thank you very much for sharing, Angela. And we hope your experience, Nicole, will be, better as well.
I have a question, if I may, for Nicole. So I'm curious first of all, thank you so much for joining and doing this and sharing all that you've learned. Did you like, was it natural for you to kind of push so hard, like press doctors to learn and get you what you needed? And or like was that a journey too? Did you go into this kind of being naturally kind of a very much a self advocate, or or not? And if not, how did you come to that part? How did you become like that?
Yeah, well, it definitely took some practice. I think having to advocate a lot for the endometriosis care, like that took a lot of different providers over a very long period of time. So I think maybe I had some motivation behind it, but I still needed some practice in pushing back against providers because first I wasn't feeling very well. So you really need like all of your resources and all of your strength and all the wherewithal to be able to respond on the spot when you feel like you're not being heard. And that zaps a lot of resources. So I think it took a lot of practice to just make that kind of second nature, like not doubt yourself, not waste any time worrying about like, oh, is this too bold to say this? I mean, it's really, you have one brain. I had one period of medical leave where I had to really make the most of that time. So there are a lot of motivators behind it that I just quickly got up to speed in learning how to push back and then just seeing what the response was and if it was helping, then I kept doing that. And if I didn't get a good response, then I would try something else.
Do you have tips for people on how to do that? Because I feel like people really see physicians as authority figures, and and uh, and physicians often try to present themselves as authority figures, right? They might call you Nicole, but you have to call them Doctor so and so, for example. And I'm just curious how if you have any tips for people who may feel perhaps a bit intimidated by that, to just break through their own intimidation.
Yeah, well, I think there's definitely a way to do it where you're still kind of honoring the respect that you have for their profession. Like I have a lot of respect for providers and really acknowledging, like, oh, but I appreciate what you have to say about it. However, my concern and the tip that I have is always have things written down. So whether it's on a post-it note, I have this and a pen with me everywhere I go. To have it written down. And actually, the more fluorescent it is, the better because you have it right in your hand and you can't really ignore it. Here's the main point that I came to this appointment to address, and I don't think we've addressed it, or 3 points or whatever it is. And I think it's as simple as that. It's just the fact that you have a need and it's your body. You have a right to advocate for yourself. And, it's fair. It's a conversation. You want to have kind of that mutual collaboration happening. And that's all you can really ask for. So when it's written down and it's just a fact and it's just a thing that you're saying, we didn't get to this yet. Sometimes that's the most straightforward way.
Thank you.
Oh, and the other thing too, and I meant to mention this before, if you can, which is a little bit challenging at times, always have somebody with you, even if they are not the note taker or the person who's going to like push back with you. Just having the presence of another person in the appointment also shows, sends the signal that this person is supported. We have some backup. We're taking note. We're going to help them. It just kind of helps the appointment go a little more smoothly in some cases.
Thank
Yes, and if anybody has a provider that they feel has done a good job, is knowledgeable with IH, please let us know. On our website, we do have a provider page. We're trying to expand on that by recommendation or from providers who have shown interest, published studies, research, anything. We're trying to make that grow. And thankfully now in today's world with telemedicine, you can sometimes see these providers, even though geographically you're not close to them, especially very, very subspecialists like a neuro-ophthalmologist, which is very rare and very hard to find unless you live in a major city. So please feel free to share a provider with us if you have it, so we can build on our website, or if you are looking for one, we do have a whole list of pretty much almost every specialty, I would say. Please feel free to look at our website for that as well. And if anyone else would like to share or any advice, any questions, we're trying to, oh, Tanya, go ahead. Feel free to.
Hi, I'm Tanya from Thailand. So it's pretty late here already, but I wanted to take this opportunity to connect first time. Because I do have some questions, and I also wanted to hear people's journey as well. Just wanted to share my story. I think I started having all the symptoms listed 2 years ago, after I had, like, actually right after I had the surgery. I had a surgery to remove the cyst and my left ovary. After I woke up, I had severe headache for 4 days, and then I started seeing like watermarks in my vision. And I think it's very rare in Thailand for people to be diagnosed with IIH, and there's not a lot of researches in Thai even. So there are some language difficulties. So for example, if I were to meet doctors, and they are not willing to study more researches in English, and the information that they can access to is quite minimal. And so I did have a lot of difficulties trying to navigate through the whole process. After I think 6 months of taking Diamox, I was able to stop the medication and be able to maintain, working and doing everything, but not so much of like exercising or traveling or flying so much, because I'm no longer on the medication. However, recently I've been having symptoms over my PCOS with irregular periods. I've been having period for almost 2 months, and so this is the time where I seek advice from the doctor again. And I was prescribed it's called progesterone, 5 milligram and 3 times a day. And after taking that for 4 days, I started having a pain in the back of my head again. So I'm not so sure if it's a stress or if it's the IIH coming back. And just for a note, when I had my lumbar puncture, this is it CSF you called? It was 46. So I never really had another lumbar puncture again ever since. So I would love to hear advice from any of you who may have heard of the same experience, or is having the same issue with PCOS or hormonals irregular, and if you have any medications that you can advise, that would be amazing. Thank you.
Well, thank you for sharing. I think kind of to your point, globally, it is a rare disease. It's difficult to find providers no matter where you are in the world. And you do also make a good point about the language. Some people of other countries don't want to, translate, and vice versa. So it's very difficult. And I'm sure you're, just pulling your hair out trying to figure all this out. Definitely there are conditions that are associated with IIH, and one of them is PCOS, for many reasons. Unfortunately, because of the name IIH, they don't know. It could be, who knows, hormonal, endocrine, it could be a constellation of things we don't know, at a very microscopic level. But sometimes when some of these conditions are fixed or treated, your symptoms of IIH improve or go away. I know one person on the chat said that after pregnancy, they were diagnosed with IIH. Before the baby and everything was fine. And then after the baby, she was diagnosed with IIH. As a woman, your body goes through so many changes, even during pregnancy, during the hormonal, menstruation cycle. This is definitely during childbearing age. So between 14, 16 years old, all the way until, a woman is in their 50s, IIH is seen in this very specific population. So I personally can't speak because I don't have IIH, but I will say from a medical standpoint, PCOS is definitely a known contributor to IIH, and hopefully a specialist can help get you treated properly so that your symptoms will improve or go away.
Okay, thank you.
Anybody else would like to say anything, ask anything? If you need to get a hold of us, because I'm trying to look at the chat and pay attention. If I've missed anyone, if anyone isn't comfortable speaking up, please go to our website, IIH Hub. You can see on the chat, there's many links that our team has added. Just shoot us an email. I promise we will get to you. We will try to, find an answer, get you some resources, connect you with somebody, answer a question that I might have missed here. Just let us know. We are here for you. The community's here for you. And we just hope for one day there's just an answer to all of this. And we appreciate you all attending today, spending the hour. Nicole, thank you so much for melding your experience as a user experience designer and putting it together in an organized fashion for, anyone's medical journey. We have just launched a patient navigation page that you can see on the screen. We hope you find that helpful. And it's at its infancy. We will be building on it as we continue to find resources and find information out there for you. And Nicole's template is on there. Our next webinar will be on June 24th at 9:30 in the morning. The presenter will be a nutritionist who has a lot of experience with the new weight loss medications that are called GLP-1s, like Wegovy, Ozempic, etc. So we will be skipping next month, May, as a webinar, but we will be back on in June. So we hope to see you there. And like I said, please feel free to reach out to us on our website. We will get back to you if we haven't answered your questions or if you need more information.